Hi, I am Dr. Lourens Coetzee and I'm a refractive surgeon at Sandton Eye Clinic. We're going to have a series on misconceptions around LASIK or laser vision correction, and our first topic on the list is astigmatism and whether one can have laser vision correction if you have astigmatism. So let's first start and discuss astigmatism. What is astigmatism? So the eye has a lens on the outside which is called the cornea, and that cornea actually bends the light and focuses the light on the retina or the macula, which is like the CCD of the eye. And this lens is not perfectly round, and if it's shaped like a rugby ball, where it is oval shaped and there's a steep and a flat part, then the light is not focused in one specific point, but the light is actually focused in a line. So an easy way for you to see whether you've got astigmatism is if your optometrist tests your vision on the board, or you look at a letter or an E at the distance, then there will be like a shadow next to it. So it will almost be like you have a double image, and the second ghost image will be towards the one side. And that is often how you see whether you've got astigmatism. Another way is where the optometrist actually shows you your script, and then there's two values. The first value is basically, we call it the sphere, but the second value after the comma is the cylinder, which points towards astigmatism. And if it's more than a value of 0.75, then it starts to influence your vision, or has an influence on the quality of your vision. So often I will have patients come to me and telling me that they've asked their optometrist whether they can have LASIK, and then their optometrist said no, because they've got astigmatism, they cannot have LASIK. And this is actually not true. We can treat astigmatism up to 6 diopters, which is quite a significant amount. One should, however, remember that some eye conditions present with astigmatism, like keratoconus, and these conditions, it is a contraindication to perform laser vision correction on them. So we know that there are some cases where you can actually perform laser vision correction on, or limited laser vision correction on patients with keratoconus, but that is a very specialized field and a specialized case. The norm is no laser vision correction for these patients, and that's probably why optometrists will note that patients with astigmatism cannot have laser vision correction because of the close association between astigmatism and keratoconus. But so how would you know whether your astigmatism can be corrected by laser? So you probably have to see a refractive surgeon, and they have to do special scans, and then they will be able to tell you whether you're a candidate or not. But one of the ways that often points towards whether you can, whether it might be suitable for you to have laser vision correction is if you can see well with your glasses on, if you've got astigmatism and you have good quality vision. That normally indicates that one should probably be able to do laser vision correction on your eye, or LASIK on your eye, depending on how other parameters, how thick your cornea is and the shape overall. We might not always be able to do LASIK and rather do PRK, but that is for another video where we will actually talk about the difference between LASIK, PRK and lenticle extraction, the various types of laser vision correction.